hypochromic. So micro means small, hypochromic, chrome there is talking about the color. So the color is not as it should be. So hypochromic. And then next it can be nomocytic, nomochromic. So normal color, but a normal cell, but there is anemia. You can see this in hemorrhage, hemolysis, when the blood cells are being broken down. And lastly, we have macrocytic. It can be big. And so before we come back to the classification of anemia, let's just look. Similar thing can happen in platelets. So when it affects your platelet, when there is reduction in platelet, it can lead to what? Bleeding. And so your blood cannot clot because there is reduction. Then also when there is an increase in platelets, it can lead to thrombosis. So there's too much platelets, and what happens? They just begin to clot in your body. If there's an intravascular issue with your vessels, from the endothelium lining of the vessels and the rest. We'll look at all this as we go on. So before we continue, make sure you subscribe to this channel. Yes, we'll be dropping a lot of important things as this. Okay, let's continue. So the mnemonics we use for microcytic hypochromic anemia is TAOS. TAOS. So what is the T? T stands for thalassemia. So if your alpha or beta chains are not complete, it can lead to what? Anemia. And so they become smaller. It's not complete, obviously. It will become smaller. Then next, anemia in chronic disorders, in chronic diseases. And so the cells also become smaller. Then I is iron deficiency. If there is not enough iron, iron is a component of the heme in your hemoglobin of red blood cell. So if it is not complete, obviously it will become smaller. It will become hypochromic. The color will not be the same. Then lead poisoning. Poisoning from lead will also contaminate the RBC and cause microcytic hypochromic anemia. And lastly, we have sideroblastic anemia. Sideroblasts, they are the cells you see. So basically, yes, that's it for today. That is summary of what you should know when it comes to hematology. So once you understand that hematology, we have RBC, white blood cell, platelet, and plasma. And hematology is study of blood and its components. Once you begin to identify the traumatic